Using chemical peels is a solution to looking younger that continues to grow in popularity. These treatments peel away damaged skin to expose healthy skin, leaving it looking younger and healthier. But what exactly are chemical peels? Let's take a closer look to see if these treatments might be right for you. Chemical peels are one way to exfoliate and resurface the skin using acidic substances to break up the top layer of skin, allowing it to peel or fall off over several days. Unlike physical exfoliation such as scrubs and microdermabrasion, chemical peels give you a more even exfoliation without undue trauma to your skin. It can be customized depending on what type of acid you are using and what percentage. What can peels be used for? If you're wondering if a chemical peel is right for you, you will want to determine what your goals are for your skin. Chemical peels have many benefits and target several different skin concerns. The treatment can be done on different areas, including the face, neck, or hands, and can be used to treat acne, sun damage, including age spots and fine wrinkling, skin texture, pigmentation issues like melasma and post-inflammatory hyperpigmentation, and finally, superficial scarring. The first thing to consider is the depth of the peel. There are three types of chemical peels based on the depth of peel. Let's begin with superficial peel. Superficial peels are the most common of the three and are popular because they require little to no downtime. Superficial peel is also known as lunchtime peel, and it penetrates the outer layer of the skin, namely the stratum corneum and epidermis, to gently exfoliate it. This will leave your skin feeling smooth and can help with mild skin discoloration. This is the type of peel you do at home with alpha hydroxy and beta hydroxy acids such as lactic, mandelic, and low-strength salicylic acids. You likely will have mild flaking over a few days without much downtime. A medium depth peel penetrates not only the outer layer of the skin, but also goes deeper, as deep as the junction between your epidermis and dermis. This is used for more extensive texture and pigmentation issues, wrinkles, and superficial scarring. These peels are typically administered in a doctor's clinic and have about 5 to 7 days of downtime. There will be significant peeling after several days, and you should lay low, avoiding sun, and intensely hydrate your skin. This category of peel includes TCA, Jesner, and high percentage glycolic acid. A note of caution: people with darker skin types, or if those who tan easily, are at risk of hyperpigmentation with these peels. Medium depth peels are a great item in our toolbox and can yield beautiful and longer lasting results than superficial peels. This is something that can be done a few times a year. A deep peel penetrates even deeper in the dermis, and because of that, it can help address more advanced texture issues such as deep wrinkles and moderate to severe scarring. A deep peel comes with a much higher risk of scarring or infection, so must only be performed by a doctor who has extensive experience. Some deep peels are done under anesthesia or sedation. However, in my practice, I offer a revolutionary type of deep peel which does not require anesthetics or sedation, thanks to its patented formula. This technologically advanced and patented formula allows this peel that we offer to reduce the downtime to only 10 to 14 days. Examples of deep peels include phenol peels and high percentage TCA. There you are, a beginner's guide to chemical peels. Please visit my website for more information on the ins and outs of chemical peel, your suitability, and what each type of the peel entail. If you're ready to take advantage of the benefits of a chemical peel, schedule a free consultation with one of our receptionists. Our contact detail can be found in the description box.